Hello, and thank you for joining us and for your support. And welcome to PETA's October Town Hall. I'm Lisa Lange, PETA's Senior Vice President of Communications. Today we'll be hearing from four of PETA's best. PETA President Ingrid Newkirk, Senior Vice President Kathy Guillermo, PETA Vice President of Evidence Analysis Dan Payden, and Jeff Brown, Science Advisor with PETA's Regulatory Testing Department. During the next hour, they'll reveal exactly how PETA is stopping cruel and deadly experiments on animals. If you'd like to listen in through your computer rather than on your phone, just visit PETA.org/October Town Hall, and that's all one word. Once you're logged in, you'll be able to hang up and follow the entire meeting through your browser. Ingrid and all of tonight's presenters will be answering your questions live later in today's Town Hall. If you're joining us on the phone, just press 0 at any time, and you'll be transferred to a PETA staffer who will take your question down and put you back in the meeting. If you're watching through your computer, just enter your question in the field at the bottom of your screen. Today's Town Hall comes in the last days of PETA's Stop Animal Testing Challenge. So I hope you'll seize the opportunity to double your impact on the breakthrough work we're discussing. Every gift we receive during this meeting will be matched, dollar for dollar. To have your gift matched, just press 7 at any time. You can also double your gift by visiting PETA.org/match before midnight Saturday. For those just joining our town hall, I'm Lisa Lange, your host for this special meeting on PETA's work to stop animal tests with Ingrid Newkirk, Kathy Guillermo, Dan Payden, and PETA scientist Jeff Brown. Before we start, a quick reminder of 2 easy ways you can participate at any time during today's call. Press 0 to ask a question, or press 7 to make a gift that will be immediately matched through our Stop Animal Testing Challenge. Okay, most of our callers, it seems, are online now. So let's begin today's town hall with PETA President Ingrid Newkirk. Ingrid?
Thanks, Lisa, and welcome new friends and long-timers to our town hall meeting on how PETA is stopping deadly experiments and getting animals out of those awful laboratory cages. I am here tonight at the Nancy Alexander Center for Animal Rights in Washington, D.C., and recently, right here on Pennsylvania Avenue, actually, just across from us, and down the street from the Capitol and the U.S. Supreme Court, we set up these 2 massive solid cubes covered with stories and images of animal experiments that have been conducted since the 20s through to today. The cubes sit next to this beautiful sculpture of a dog and a rat whose plinth carries the exhibit's title, Without Consent. And throughout much of modern history, human animals, particularly those marginalized by society, have suffered at the hands of experimenters, all, of course, also without their consent. Perhaps the most infamous of those studies happened in Tuskegee, Alabama. That's where treatment was deliberately withheld from impoverished black men who were infected with syphilis, but instead of being treated, they were simply allowed to die as part of a study they had no idea they were in. There were also soldiers who were unwittingly used in poison gas tests by the Army, and orphans in institutions who were purposely exposed to tuberculosis. Today, society regards those tests as horrors from the past. But due to ingrained speciesism that we must shake off, many people ignore the torture of others who've not been granted any consideration and who have not granted their consent to be experimented on. Right now, there are as many as 100 million living, feeling individuals, each an individual like you and me, sitting on metal or in a plastic box, scared out of their wits. Each one of them, from the dog who has been held for years in a cage at Texas A&M, to the tiny mouse bred to suffer from painful deformities at the Cleveland Clinic, they feel fear and loneliness and love and sadness. At PETA, we use the Freedom of Information Act to get the emails and the internal reports generated by experimenters. And what we see is that they regard the suffering of these sensitive animals as inconsequential, or they're oblivious to it, despite their having earned a PhD or some other degree. Just as trophy hunters laugh over the bodies of the lions and the elephants that they gun down, we find that vivisectors joke about the animals as they inject them with dangerous chemicals or slice them open with inadequate anesthetic, and their babies that they take from their mother's breast seem amusing to them, or worse. They're so casual about killing the survivors. We've even seen messages taped onto laboratory freezers that read, "Hey, make sure they're dead before you put them in the freezer." I won't tell you much more because our investigators do document things that are frankly far too upsetting to hear. It isn't, however, all bad news. In 1980, it was almost unheard of to even question the use of animals by experimenters. That was before PETA broke the Silver Spring Monkeys case. And that case sparked a movement that's been changing how even many scientists now view animals and their rights. That groundbreaking PETA investigation is just one of nearly 200 that we featured on the Without Consent exhibit, including some grotesquely cruel, absolutely pointless, and totally bizarre experiments that PETA has stopped. For me, I can never forget the University of Pennsylvania experimenter Thomas Gennarelli. He and his staff cemented helmets onto baboons' heads, and then they used a hydraulic device to violently thrust those monkeys' heads forward with up to 1,000 units of G-force, inflicting tremendous head injuries, all without painkillers. We got the video evidence of that and of staff prying the helmets off the brain-damaged animals by using a hammer and then mocking their misery. One experimenter laughed while she was being filmed, and she said, "We'd better hope that PETA doesn't get hold of this footage." Well, we did, and that laboratory lost its funding, and those experiments ended. The Without Consent exhibit also tells the story of a monkey known only as V357. Perhaps he's called that because experimenters are warned not to give real names to their subjects in case they start thinking of them as individuals. Well, V357 was used in a nerve agent attack training at the U.S. Army's Aberdeen Proving Grounds just up the street here in Maryland. Every 8 weeks, experimenters injected him with a massive drug overdose, trying to mimic a chemical attack. He sweated profusely, he went into convulsions, and he struggled to breathe. Several of his fingers were also bitten or torn off in fights with other monkeys in adjoining cages. He died alone in his cage after experimenters injected him with a chemical that severely restricted the blood flow to his brain. Pressure by PETA and our supporters, our wonderful supporters, led the Army to end those experiments too. So while some of the experiments covering the walls of those 2 somber black cubes do continue, the many that we've already stopped make PETA the leader in the global fight to stop experiments on animals. In the last year alone, PETA got one of the last major holdouts, Avon International, to stop their tests on animals everywhere in the world, including in China. And we added huge household names like Suave, Dove, Aussie, and Secret to our Don't Test on Animals list. We've succeeded in getting Bristol-Myers Squibb, GlaxoSmithKline, and 12 other big pharma companies, along with universities like King's College London and the University of Adelaide, to stop forcing terrified animals to frantically swim for their lives in what's known as the forced swim test. we persuaded major companies like famed Swiss chocolate maker Barry Coulbeau to stop commissioning experiments on animals altogether. And we've pushed the entire global food and beverage industry to change, with major corporations like Kellogg, Chivas Regal, and Dole adopting animal test bans. We talk to those companies, but sometimes discussions don't work. So PETA files lawsuits. It was our lawsuit against the University of Massachusetts Amherst that led to the disclosure of dozens of hours of video footage of taxpayer-funded experiments in which monkeys were deliberately terrified and then driven insane from confinement. I'm very happy to tell you that after we filed our suit, the University of Mass experimenter, who had built a career on abusing monkeys and who was a protege of infamous baby monkey torturers Harry Harlow and Stephen Suomi, abruptly retired. In a minute, Kathy will tell you more about a similar lawsuit that we've just won involving animals condemned to suffer at the Oregon Health and Science University's primate lab. Something wonderful is coming too. This year, our scientists distributed a landmark PETA report. It's called the Research Modernization Deal, and we sent it to all federal health research agencies. What it does is set out exactly and why they should redirect funds from useless animal experiments to state-of-the-art non-animal research methods, ones that hold real promise. And many people at those agencies are sitting up and taking notice. We're running a TV spot in Washington, D.C., as I speak, to draw the attention of government employees to this strategic report of ours. Oh, and something about COVID I should mention. PETA consulted with Bolivian engineers who were going to use pigs to help validate some new type of ventilator for use on COVID-19 patients. And guess what? We got them not to use any pigs at all. Our Without Consent display is about to go on the road to cities and college campuses. So please remember, your gift through PETA's Stop Animal Testing Challenge tonight does mean the world to our work. It will be matched, and immediately it will bolster our work for all those monkeys and mice and other animals who are facing abuse in experiments. So please, when you can, please press 7 to give tonight. And before I hand this back to Lisa, I do want to say an enormous thank you to each and every one of you who are joining us today, because your being here with us on this call helps not only support our work financially, which is vital, but it boosts our let's win this together spirit, even more knowing that we can count on your activism, your interest, your ability to educate others, and your support. And nothing could be more critical to us than that. So, Lisa, back to you.
Thank you, Ingrid. 2 quick reminders for our listeners. First, press 0 on your phone at any time to submit a question that Ingrid and the other presenters will answer live later tonight. Second, an exciting announcement, tickets are now on sale and going fast for PETA's spectacular virtual 40th anniversary and holiday party on Saturday, December 12th. You really don't want to miss this star-studded PETA celebration, so be sure to visit PETA.org/events and reserve your ticket before it's too late. Now let's welcome on a guest familiar to many who've attended our town halls, PETA Senior Vice President and Head of our Laboratory Investigations Division, Kathy Guillermo, to share how we're ramping up our work to end cruel experiments at Texas A&M University and other institutions. Kathy?
Thanks, Lisa, and my thanks to all of those listening for making my team's work possible. In the U.S., the National Institutes of Health sets much of the agenda for research, and they fund more basic research than any other institution in the world. Unfortunately, much of what they fund is simply bad science, and animals are suffering on a massive scale because of it. The NIH knows that 90% of all basic research, most of which involves animals, fails to lead to human treatments. Yet half of their $40 billion research budget is spent on animal tests, and most of that money is going to universities. PETA's been challenging the NIH's cruel and wasteful reliance on animal tests since our very beginning, and at every turn since. Just last week, we started running radio ads in the D.C. area featuring PETA honorary board member Bill Maher, condemning the NIH's waste of $36 million taxpayer dollars on experimenter Elizabeth Murray's cruel and pointless monkey fright experiments on rhesus macaques. This follows TV ads that ran on all DC networks. But now, with so many laboratories racing to develop new treatments and vaccines to combat the novel coronavirus, the need to stop those experiments is more urgent than ever. And since the pandemic began, it's often the experimenters themselves who are helping us make that point. Last spring, when lockdowns led many workers to be deemed essential, scores of animals trapped in laboratory cages were suddenly considered to be anything but. As laboratories closed their doors and sent students packing, animal experiments in university laboratories across the U.S. began to be ramped down, curtailed, or delayed. Not long after, we started receiving reports that countless animals slated to be used in crude and worthless experiments were being killed en masse in university laboratories. Thousands of mice and rats were beginning to be euthanized, typically killed with carbon dioxide, though many also had their necks broken. Universities like Stanford, the University of California at Berkeley, the University of Washington, and the University of Michigan, huge research universities, all called on their faculty to work on reducing population numbers of animals in laboratories. This killing spree of animals, whom experimenters claimed were critical to their work just weeks before, raises a larger question about all university experiments. If these animals were truly non-essential, why were they ever bought, bred, and experimented on in the first place? We quickly wrote to the Health and Human Services Administration to ask why the NIH is pouring billions of taxpayer dollars into animal tests that universities themselves consider to be extraneous, particularly when federal policies require experimenters to reduce and replace the use of animals in their tests. We followed that up with letters to every single research university receiving public funds, urging each to immediately suspend all animal experiments. We also asked that they honestly review the effectiveness of current and planned experiments in helping humans, the harm to animals used in them, and the high failure rate of these experiments on animals. Media outlets widely reported on our letters and helped us make clear to the public just how wasteful experiments on animals really are. Some of the responses we received from these universities reveal just how entrenched the reliance on cruel experiments on animals is among their faculty. When we asked Cornell University to make public the number and species of non-essential animals likely to be killed during its shutdown, the school both ignored our request and password protected its previously public COVID-19 page that urged experimenters who use rodents and fish to kill up to 40% of those animals. Johns Hopkins University took their response to our letter even further. The school's Associate Director of Research Animal Resources, a title that itself speaks volumes about how little consideration JHU has for the individuals they torment, they told the journal Science, quote, categorically no mice or any other animals have been euthanized in an effort to conserve resources, end quote. Little did he realize that we had ample evidence to the contrary. The mandate to euthanize extraneous animals came from that director himself in a pair of emails to Johns Hopkins staff that we had in hand. Now we're taking our challenge to the next level, contacting the auditors of states whose taxpayers are paying for such useless and cruel experiments, urging that they mandate experiments involving these newly unnecessary animals never be restarted, and that new experiments on animals no longer be approved. At least 2 investigations are already underway, so more to come on that soon. Of course, Johns Hopkins' absurd response to our letter shouldn't come as much of a surprise, considering the basement torture chamber they've allowed experimenter Shrees Mysore to operate. In a secretive laboratory, Mysore cuts into barn owls' skulls to expose their brains and attaches a metal device to their heads. They're then crammed, conscious and awake, into a kind of a straitjacket before experimenters clamp their eyes open and bombard them with loud and distressing sights or sounds for as long as 12 hours at a time, all the while poking around in their brains. The owl's brain tissue eventually becomes so severely damaged that they're deemed unusable and killed. Mysore is receiving more than $1 million, much of it from U.S. taxpayers, to torture these highly sensitive birds in sadistic, curiosity-driven tests, which he ludicrously claims will help him learn about ADD in humans. Even Mysore himself knows that his experiments on these animals could be misleading. In a damning new audio recording we uncovered, he states that surgically fixing an owl's head in place could lead experimenters to misinterpret what's happening. Yet that's exactly what he's doing to these owls, with JHU's blessing. What's more, it appears that Mysore violated Maryland law in failing to obtain a legally required permit from 2015 to 2018 to possess protected birds for experiments. Our campaign to stop Mysore's cruel experiments is growing by the day, and we won't let up until they do. Just last week, Harry Potter star Ivana Lynch wrote on our behalf to the president of JHU, demanding that he put an end to these excruciating experiments. And our supporters gathered in front of the home of the school's dean of medicine to call him out for allowing these admittedly worthless and apparently illegal experiments to happen on his watch at all. But Johns Hopkins isn't the only university feeling the heat of a PETA campaign. We're not easing up on Texas A&M either, as Lisa will tell you.
Thanks, Kathy. Some of you may know that Texas A&M's football team is considered a powerhouse, with millions regularly tuning into their games. So how better to draw attention to the school's muscular dystrophy experiments on golden retrievers and other dogs than while Texas A&M football fans are glued to their TV sets. That's why a pair of PETA activists sporting shirts and signs proclaiming Texas A&M Stop Cruel Dog Tests rushed onto the field as a national audience watched Texas A&M play Mississippi State last week. While the activists were literally tackled and dragged away by security, their message went out on the wires, bringing more attention to our campaign. Back to you, Kathy.
With every letter from a PETA supporter, every disruption of a university regents meeting, and every eye-catching protest like this, we're coming closer to getting dogs out of Texas A&M's laboratory where they're used in excruciating muscular dystrophy tests. Decades of tests and generations of dogs condemned to these horrible experiments haven't moved us toward a cure. But little by little, PETA's getting closer to seeing that awful laboratory shut down. Earlier this year, we prevailed in a pioneering First Amendment lawsuit that forced Texas A&M to stop blocking Facebook comments about the university's experiments on dogs. It also had to pay our legal fees. But it seems that Texas A&M takes a while to learn a lesson. So in August, we sued the school for a second time over its deletion of comments made on its Facebook page, as well as deletions made on its YouTube page during its virtual graduation ceremonies. The school's insistence on removing these comments, despite their legal loss, is a sure sign of just how much they fear social media users learning the truth about their experiments. And just yesterday, we filed a third free speech lawsuit against Texas A&M. You may remember that last year, after enormous pressure from PETA, our supporters, 500 physicians, and many people with muscular dystrophy, Texas A&M stopped breeding dogs to develop the disease. This was a massive victory, and it signaled the demise of the laboratory. Today, many of the nearly 100 dogs held there have been adopted into homes, including Lucilla, Perinia, and Cheddar, whom our supporters helped free just last month. Right now, there are just 25 dogs, at least 12 of whom are perfectly healthy, still imprisoned in its lab. We have repeatedly offered to take them and place them in good homes, but the university stubbornly refuses to declare its obvious defeat. Texas A&M can count on even more headline-grabbing pressure from PETA to win their release. Lisa?
Thank you, Kathy. And thanks to all of you who are regularly calling and emailing Texas A&M to pressure them to end these horrifying experiments. Please don't forget that you can double your impact on this and all of our life-saving work for animals in laboratories by pressing 7 on your phone and making a gift right now during our Stop Animal Testing Challenge. Every dollar you give tonight will be matched, pushing us closer to our $500,000 goal.
Thanks, Lisa. And we already have some wonderful people to thank. I won't get to everybody. Ethel from Texas, $100. Mary Francis from Missouri, $25. Robert from Virginia, $115. Inga from British Columbia. Laura from Oyster Bay, California. That sounds nice. $200. That is a marvelous start, and everything, of course, will be matched this evening. I cannot emphasize enough how important reaching that $500,000 goal is, because remember, we're up against multi-million-dollar institutions. Just one pharmaceutical company alone can wrap us around in its profits. So everything costs, particularly funding alternatives to animal use. If we make it, we'll see an instant $1 million boost to all this vital work of PETA's scientists and our campaigners and our investigators, and that will be truly a super accomplishment. So thank you all. Please press 7 if you can. Get your donation matched. Joining us now is Dan Payden. He's PETA's Vice President of Evidence Analysis, and he's going to fill us in on his team's 6-month-long undercover investigation of a really hideous primate facility. Over to you, Dan.
Thank you so much, Ingrid, and good evening, everyone. I just want to echo the thank yous that have been sent your way earlier. Right now, tonight, there are 7 national primate research centers, so-called flagship centers, and collectively, they breed and experiment on thousands of monkeys every year with the help of hundreds of millions of taxpayer dollars provided by the National Institutes of Health that Kathy spoke about. Over and over again, PETA has exposed rampant abuse at these hellish places. And yet, even after racking up a mile-long list of serious violations of the Animal Welfare Act, these facilities have operated virtually unchecked for decades, and they condemn primates to suffer behind their bleak walls every day and every night. Well, earlier this year, one of PETA's investigators worked, as Ingrid said, undercover for 6 months at the Wisconsin National Primate Research Center, which is known as WNPRC for short, and that's on the campus of the University of Wisconsin in Madison. WNPRC condemns nearly 2,400 primates to spend every week, every month, year after year, in barren metal cages. And while there, our investigator documented highly intelligent primates driven mad by confinement, in some instances for as long as 20 years that these animals had spent in cages, and others being attacked by their traumatized cage mates in those stark, unnatural living conditions. One monkey, for example, named Ellie, lost part of her ear in a fight with a cage mate. Well, rather than care for these animals' basic needs, workers treated their captives with cruelty and, frankly, with contempt. They hauled males from the cages to a restraint chair by a heavy metal collar before electroshocking them on the genitals so they could collect their semen, so they could breed and continue to produce more animals to torment and sell. These animals paced, they circled endlessly as they tried to cope with what you can imagine is incomprehensible anguish. And some, like a macaque named Princess, pull out their own hair and they end up nearly bald. And her obvious misery and stress didn't deter WNPRC from breeding Princess over and over again and leaving her to give birth all alone in a wire-floored cage, and then watch helplessly as year after year her babies were taken away from her. Some other babies, one of them was named Cora, for example, never even got the chance to meet their mother. after her mother was killed in a cesarean section experiment. Cora was shuffled off to a bleak basement. She was given a little stuffed animal and nothing more for comfort. Mind you, this animal was 1 day old and just torn from her mother, never even laid eyes on her mother. She's given a stuffed animal for comfort, and then workers with no anesthetic pierce her ears with metal clamps, rub ink all over the wounds so that they can know what number to assign to her. The University of Wisconsin at Madison, which is the so-called parent institution of WNPRC, has proven unable to keep the animals it imprisons healthy, safe, alive, much less happy. Back in April, the U.S. Department of Agriculture actually fined the university $74,000, which of course is a fraction of the millions they take in, for depriving animals of basic care. And thankfully, the day after we released this case, the USDA and NIH confirmed that they are investigating this facility. WNPRC was not the first of these primate centers that PETA has investigated, and you know it won't be the last, but we will succeed in shutting all of them down, just as we did with Harvard's New England Primate Research Center, which closed its doors in 2015 after more than 3 decades of PETA protests. Kathy.
Thanks, Dan. Another primate prison PETA has investigated repeatedly is the appalling Oregon National Primate Research Center, a facility that's affiliated with Oregon Health and Science University. In 2000, a PETA investigator went undercover there and found misery at every turn. Monkeys driven mad by their confinement, pacing in endless circles and self-injury, macaques forcibly bred over and over again to supply new victims for experimenters, and baby monkeys, frightened and alone, curled into balls, hugging themselves for some shred of comfort. A PETA investigator went back in 2007, and after 4 months undercover, found nothing had changed for the more than 4,000 monkeys held there. Monkeys still whirled, rocked, and paced out of frustration inside their small cages. One monkey named Isaac, whose eye was removed so that experimenters could induce a stroke, was found dead in his cage just 1 day after the surgery. Another 18-year-old monkey named Penelope reportedly suffered severe pain for more than a month and only received adequate pain relief just before she was killed. OHSU received more than $218 million in grants from NIH last year, despite a long list of USDA violations covering everything from deaths by dehydration to failure to give postoperative pain relief. Taxpayers are paying for OHSU's cruelty, and they have the right to see exactly what they're paying for. So after the university denied PETA's request for video of so-called junk food experiments on threatened Japanese macaques taking place there, we filed an open records lawsuit against them. In August, the judge ordered that 74 videos be turned over to us. What we received makes it clear that the university is a chronic abuser. The newly obtained videos reveal baby monkeys separated from their mothers or their friends, placed in an unfamiliar room, and locked inside a small barren cage where they were deliberately frightened in so-called human intruder tests. Some young monkeys were so traumatized by this sudden separation and the scary humans intimidating them that they would desperately fling themselves around the cage. Others froze in place, too terrified to move. Experimenters killed most, if not all of them, when they were just 13 months old. OHSU experimenter Eleanor Sullivan received $5.2 million in taxpayer money to impregnate these babies' mothers and feed them high-fat food. But that's not the only cruel and worthless experiment she's been behind. Sullivan also removed the brains from monkeys' fetuses and even frightened baby monkeys with a Mr. Potato Head toy, another taxpayer boondoggle. She and her colleagues have forced monkeys to run on treadmills at increasing speeds until they collapse. And in 2018, she published the results of a cruel experiment in which half the female monkeys' pregnancies ended in miscarriage because the animals, who thrive on a hierarchical structure, were thrown together as strangers, resulting in, quote, an unstable group environment. OHSU has taken more than $250 million in government handouts for these kinds of senseless and cruel experiments. It's time that they shut down the Primate Center and put their money into cutting-edge, non-animal experimentation that shows real results for humans.
Thanks, Kathy and Dan. In a few minutes, tonight's presenters will be taking your questions live, so you may wish to get yours in now by pressing 0 on your phone. I also hope you'll keep all of our vital work going strong by pressing 7 and making a special gift to PETA's Stop Animal Testing Challenge right now. Every dollar you give tonight will be matched. Now back to Kathy to tell us a bit more about how PETA scientists are keeping millions of mice, rats, dogs, and other animals from suffering in cruel regulatory tests. Kathy?
Thanks, Lisa. First of all, my thanks to Barbara from Massachusetts for a $1,000 gift. Thank you so much. From Margaret from Pennsylvania, $150. And thank you to Francis from North Carolina, $100. And Geraldine from New York, $50. Thank you. We really appreciate it. So there's a very good reason a PETA scientist was seated next to the director of the EPA when he made his historic announcement about ending the agency's tests on mammals. PETA has more scientists on staff working to stop archaic experiments on animals than any other animal protection organization. And today, those scientists are helping to replace them with modern non-animal test methods. Joining us now is one of those scientists, PETA Science Advisor Jeff Brown, who's going to tell us more about all that he and his colleagues are helping us to accomplish.
Thanks, Kathy, and a very big thanks to all of you on the call. Your support really does mean the world to us. I'm extremely pleased to be a part of the PETA science team that's bringing about this sea change in the use of animals in testing worldwide. I first became passionate about saving animals and working for PETA back in middle school. I was on a field trip that was meant to get students interested in scientific research that included a tour of the National Center for Toxicological Research in Arkansas. And there I saw a restrained monkey who had been trained to extend his arm for injections when an experimenter would press a clicker. And that was something that he'd been conditioned to do through pain and fear. And seeing that trembling monkey touched a nerve in me, and it got me interested in science, but not in the way that that experimenter had hoped. Because today, I advise PETA on how the safety of medical devices, drugs, and vaccines can be assessed without harming animals. And I've seen firsthand the astounding progress we're making thanks to your support. And as scientists ourselves, we're able to use our expertise in toxicology, in molecular biology, biochemistry, all the biomedical sciences to keep animals from being condemned to suffer in these cruel and worthless experiments. And actually, just this morning, the UK newspaper The Independent shined a spotlight on one way our scientists are making a difference. You may remember that PETA India released a landmark investigation of the antitoxin industry that found thousands of horses, many of whom are rail thin and suffering from severe untreated injuries. They were all being held in absolute squalor, while as much as 2 gallons of their blood is drawn over and over again without anesthesia every month for their entire lives. And that's because for more than 100 years, the only method of combating diphtheria, which is an extremely contagious infection that routinely ravages communities in India and Bangladesh and in many other developing countries. The only way of treating this illness was to inject horses repeatedly with the diphtheria toxin and then drain these huge amounts of their blood to collect the horse's antibodies. And supplies of these antibodies are limited to what companies can extract from the horses that they abuse, so there's never enough. And to make matters worse, horse antitoxin is such a bad product that its efficacy varies from vial to vial. So patients who receive it never know if the treatment they're getting will work or if it will cause other incredibly serious, life-threatening health problems. So why hasn't something better, something made from human antibodies, already been developed? And it comes down to economics. Treatments for diphtheria are most needed in countries that often can't afford to pay for them. And that's not much incentive for pharmaceutical companies to develop new treatments. Now, thanks to a groundbreaking project funded by PETA, we've succeeded in creating fully human-derived antibodies that are capable of treating diphtheria. And we're hopeful that someday soon their adoption will cause those miserable horse facilities to shut down. PETA scientists frequently collaborate with governments, with academia, and industries to fund the development of non-animal methods like this. And once that step is done, to make sure that those methods get used far and wide. And to make this revolutionary change happen, we host free workshops and webinars, 7 so far just this year, all to help researchers learn how to use these non-animal tests. We meet with and we organize training opportunities for government staff so that they can learn how to use and approve non-animal methods. And our work is now regularly published in prestigious scientific publications, and we present at major conferences as well. I am so pleased that we're shattering the age-old mindless approach to the development of drugs and vaccines that relied on animal testing as a required step. That's an approach that costs tens of millions of animal lives every year and wastes enormous amounts of time and money in the process. Take experimenters' futile attempts to learn about COVID-19 by squirting virus in monkeys' eyes and up their noses. We know that monkeys can catch COVID-19, but it tends to manifest in different ways in them than it does in humans. And you may have heard this startling statistic before, but 95% of drugs that are shown to be safe and effective in non-human species end up failing in human clinical trials. There's just no way to reliably predict whether a vaccine that prevents COVID-19 in a monkey will protect a human. And equally, experimenters could be shelving life-saving treatments and vaccines because they don't work in animals, but they might work in humans. So why test human treatments and vaccines on monkeys or on other animals at all? Governments really are starting to get the message that animal testing needs to go, and more importantly, that it can go right now. The FDA recently unveiled its Coronavirus Treatment Acceleration Program, and this was to get new treatment and vaccine development plans reviewed quickly. And as a part of this, the FDA has already allowed one of the leading COVID-19 vaccine candidates to be tested in human clinical trials without first having to pass through all of the misleading, years-long animal tests that have ordinarily been required like a hurdle that has to be cleared before human clinical trials can begin. This is another historic win, and it happened because the FDA is finally beginning to acknowledge that animal testing is dispensable and that it slows down the discovery of safe and effective vaccines. And this is after decades of pressure from PETA. So myself and all of PETA's scientists are saving lives and doing away with animal tests that have been used for decades. And I know that each one of us is incredibly thankful for the PETA members who make our breakthrough work for animals possible.
Thanks so much, Jeff. Every time we stop a proposed test or end one that has been in use for decades, it's you, our supporters, who share in that victory. If you haven't already, please take a moment to press 7 on your phone right now and make a generous gift that will do twice as much to power our work to stop deadly experiments on animals.
Yes, Lisa, before we take those questions, coming up any second, please allow me to thank a few people who are really making a world of difference. We have Pavati in Michigan, $75 will become $150. Thank you so, so much. We have Dominic in Ashton, Pennsylvania, $200. Bless your heart. We have Josie in Ashburn, North Carolina, and Liz in Ontario. Each gave $1,000. That is tremendous. Donna in Michigan, $500. Charles in New York, Violetta, $700. Thank you, thank you, thank you. And Lynn in California, $10,000 will be $20,000, and that will go a long way. All of you, thank you very much. You have heard how much our opposition has. so you know what we're up against. Just let me say that since I founded PETA 4 decades ago now, stopping cruel experiments on animals has been a major focus of everything that we do. And now you can just see what's happening. You can see that work is paying off more and more, like never before. There had to be a start, and now it's on a fast track. Lots to be done, but we're doing it. And I can say unabashedly that no animal organization in the world has done more to stop animal experiments than PETA has. And that's why I'm so proud of our staff, the people you've heard of and heard from tonight. I'm thankful for our supporters, each and every one of you, because the progress that we've made is progress we've made together. And that's something to celebrate this year, because none of it would have happened without your love of animals and your support for our work. So, as Jeff said, as we've all said, thank you very, very much from all of us here tonight. We are most grateful. Now, on to the questions. Lisa, I think you have some.
Yes, I do. And the first one is from a live caller, and it's Martina from Tucson. Martina, what's your question?
Thank you for taking my question, which is, what do you think the average person can do to stop all this?
Oh, Martina, that is a whale of a question and a very good one, because every single person has a role to play, and they mustn't think that this is something they can't do anything about, because each of us can. Many of us, I think we tend to give up on politicians, but we can't do that either. And I think tonight you were listening, you heard about the research modernization deal. This is a game plan, an outlined actual plan, whereby people can, whether they're in a government agency or a private institution, they can get rid of animal experiments. All our scientists are backing this to say, you're doing X, let us show you why. It's much superior, it's cheaper, and so on. So getting that research modernization deal into politicians' hands and pushing them, not taking no for an answer, making sure they know you exist, and getting it into the government, writing letters about it, those are very good things. Giving tonight, have to say it, giving tonight gives us the fuel that we need to do our work. We've got a lot of people with their sleeves rolled up, pushing this boulder up the mountainside, and we need everybody to help us push it along and to alert others. We can't just know about this ourselves. If you went to a university and they're knocking on your door and they're asking you for money, please tell them no. As long as the university does animal experiments, you won't be giving them any funds. And don't just tell the development people who call. Go right up to the chancellor and the president's office and say, this is why I'm not giving, and I'm telling all my classmates from way back not to give either. So pharmaceutical companies, if you go to our website, you'll see all the places that we need you to please push so that they stop that wretched forced swim test. And then, you can write to people like Elizabeth Murray, who experiments on monkeys in these terror tests, and all these other people that Kathy mentioned. You can get their addresses from us. They're on the web. And you can write to them at home and tell them what you think. Because, believe me, they need to hear it. They need to know that people know where they live and don't like what they do. And that stuff works. So please, there are lots more, but I will monopolize all the time if I carry on. But we need you, so thank you for that wonderful question.
And Ingrid, if I can, I'm just going to add, use social media. Everything we do, we put up on the web, Facebook, Twitter, TikTok, Instagram, and everything else. And if you just share our posts, you'll reach out to all your friends, too, about all of these campaigns we're talking about tonight. This second question comes from was brought to us on the web, and it is, if coronavirus vaccines skipped animal tests, how do we know they're safe to use? And that sounds like a good one for you, Jeff, if you don't mind taking that.
I don't mind at all. It's an excellent question, and it really couldn't be more timely. To be very frank, animal tests have never been good at showing whether any kind of drug is safe for humans. You've probably heard stories over the years of drugs that have been on the market but have been recalled, right? They're taken off of the market. And that's because even though those drugs have been through years and years of testing, usually in hundreds of thousands of animals, once people start taking these drugs, the real human experience is what drug companies rely on to make decisions about how safe any drug is in practice. So every drug recall should be called what it is, very honestly. It's a proof that animal tests aren't keeping us safe. And drug companies know this. We tell them. we coach them every day on how to avoid these animal tests. And we've been doing this for so long. We know that government agencies are really open to listening to how companies want to replace animals, to what the modern science is. And at this point, many of the animal tests that companies carry out to show that vaccines are safe, they're only carried out because government agencies like the FDA say that they have to be done. But drug companies have been investing in much more modern, human-relevant science for decades. So they're already using these better ways of finding out whether drugs or vaccines are safe without forcing animals to endure painful experiments. So the animal tests kind of are what I said before. They're like hurdles, but the rules that governments put in place, they're very slow to change. Cappy mentioned this. These rules are very entrenched. So we worked for years to get these changes made. But now that we're faced with the global pandemic, governments have finally been willing to come out and acknowledge that animal tests aren't making drugs safer. They're just slowing the process down. Vaccines are some of the safest drugs on the market precisely because companies that make them have been using these modern non-animal tests for ages. And now they're finally being allowed to let go of those animal tests that have been required for most of the last century. I hope that's sufficient.
Thanks. Yeah, that is great. Thank you, Jeff. All right, we're going to go on to our next question, and this is live from Art in Augusta, Maine. Art, what is your question?
Hello. So I think this is for Dan, if that was his name. I'm kind of wondering how investigators can see and record but not intervene when they see the kind of cruelty you were talking about in Oregon. Why don't they just step in and save the animals from that pain and misery?
Thank you, Art. I appreciate that question. That's kind of a common one, and thank you for raising it. It's not an either-or situation. It's actually a both-and. And thankfully, our people are very talented and adept at both documenting suffering and also intervening as much as they can and as much as the law allows. Just earlier this year, in fact, if you've seen our Cleveland Clinic investigation, you saw that some of the labs there were doing experiments on mice and rats, which involved cutting into their skulls and removing parts of their brains in very traumatic ways, and then covering the wounds with glass cover slips, they called them. So our investigator, in addition to documenting that terrible use of animals and violations of various federal laws and regulations, was actually able to adopt and remove 3 of the very young rats who were born in that lab and were destined for such horrible things. And those animals are now living with a PETA staffer, and they have more space than I probably have at home, and they live a tremendous life. We've also rescued, for instance, pigs from laboratories. The other thing I would say about that is that the investigators do have to bite their lip and see the big picture. The muscular dystrophy experiments, for instance, at Texas A&M that Kathy was speaking of earlier and Lisa was speaking of earlier, the breeding of those dogs has now ended, and that's probably saving scores of animals every single year from being deliberately brought into this world in a way in which their quality of life is basically zilch. That campaign started in part with video that an eyewitness captured inside that lab of those animals languishing on slatted floors, being reduced to eating nothing but gruel, essentially, which they just, because their tongues didn't function properly and their esophagus didn't function properly, they couldn't very easily take in, and it ended up basically running down their sternum and matting in their chest hair. So with the ending of that breeding, and very soon the ending of that stupid experiment and the funding for it, we hope, so many animal lives will be saved. And so sometimes the saving the lives comes, in the long run. I also think, for instance, 10 years ago, we investigated a laboratory called Professional Laboratory Research Services, and it was anything but professional. It was just over the border from our Sam Simon Center here in Norfolk, Virginia. It was just down in North Carolina. And I think 1 week after Kathy's team submitted a complaint to the USDA with the results of our undercover investigation, the lab decided it had enough, and it closed its doors. And 2 days later, a team of vans was pulled up to the door, and out came almost 250 dogs and cats. And I've had the pleasure of seeing several of them in our office here in Norfolk. And so the lives saving and the end of the suffering sometimes cannot come immediately, but it does come. And our investigators, with your support and knowing that you have their back in so many ways, continue to both, get the goods, so to speak, that will get officials to act and decision makers to change policies, but also to, rescue and adopt and remove animals and set them on the path towards the life that they always deserve. So thank you, Art, for the question, and I hope that answers it.
Dan, if I can just add a little something here. You're so right. I mean, you have to keep your eye on the prize if you're an investigator. And I will never forget one of the PETA Asia investigators saying that he will never recover from not being able to step forward and stop what was happening in the live market to, I believe it was, cats who were being thrown down and were going to be boiled. And he, every fiber of his being said he had to do something, but he knew that if he stepped forward, he not only would fail, but they would grab him, they would find his camera, they would throw him out, and then the world wouldn't see. And the fact is, the world has to see, or all this will carry on. So these investigators live with having not stepped forward. At night, they live with it for years, and it bothers them greatly. So it was a very good question. Thank you.
And I think we have time for just one more quick question. And I think this one looks like a good one for Kathy, and it's something posted online from Howard in Tampa. He asks, why does the government keep funding such cruelties, especially if they don't help humans? Kathy, do you want to take that?
Yeah, thanks, Lisa. It's such a good question, and it's one that the government at NIH needs to ask itself, because they're in real danger of falling behind scientifically because they don't modernize. And we know there are people at NIH, because we hear from them, who agree with us. So there's a little bit of a war going on over there. But the problem is that many of the decision makers about who gets funding are animal experimenters themselves. And the reviewers who actually look at the proposals for funding, for the proposed experiments, the people who decide who gets money and who doesn't get money, a lot of them are animal experimenters too. So they're perpetuating this cycle, and that's what has to change. So, we know that your phone calls, your letters that go to NIH by literally the hundreds of thousands, those can stop individual experiments, and we've done it many times, from the cat deafness experiments at the University of Wisconsin to the baby monkey experiments in the laboratory of Stephen Toomey, to the sepsis experiments, the funding of the sepsis experiments at University of Pittsburgh on mice. But now the calls also need to be to implement PETA's research modernization deal. It's really straightforward. We've had wonderful feedback from scientists on it. We did it at the request of the Dutch government that was looking for a plan, and it's been cited in their plan. So that's what needs to happen now, and that's where all of you can come in and give us a big hand.
Thanks, Kathy. Agitate, 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 agitate to liberate. So thank you, everybody who submitted a question this evening. If we didn't get to yours before the time ran out, and it has run out, never fear. Someone at PETA will be getting back to you with an answer in the next few days. And thank you so much to everybody who donated tonight. It's not too late. If you didn't make a gift tonight, there's still time to double your impact on our work. And you hear how important it is, all those individuals sitting in those cages hoping that someone will care. Just visit PETA.org/match. Match is in capital letters. PETA.org/match before midnight Saturday. And that will allow you to do twice as much to power everything that we've discussed today. So on behalf of Kathy and Dan, Jeff, Lisa, all of us, thank you very much for your commitment to making the world a kinder place for animals in laboratories. We're very glad to know that the animals have you on their side. It makes an enormous difference to our goal to end vivisection. No small project to end animal abuse once and for all. But it is a goal that we can all reach together. So please never stop caring, never stop